Good morning, everyone. Today we are going to start with the face, and this will be a basic representation before the main demonstration. So the face will be going to be covered under the following objectives. We have to identify the bony landmarks, and I hope you all had covered this topic in your last demonstrations. And then we will be seeing the limit of the face, and then you have to identify the different parts, basic outer morphology. Then we'll be doing the basic important major muscles. We will be seeing and discuss their actions and the nerve supply, considering of the orbicularis, oculi, aureus, nasalis muscle. And then we'll be seeing the prominent facial muscles, that is the corrugator supercilii, levator labii, lip superioris, and elecgnasi, zygomatic major and minor, platysma, risorius, levator, levator and depressor anguli aureus, depressor labii inferioris, and then we'll see the identification of neurovascular structures which are present in the region of the face. So let's begin with the limit of the face. Face is the front aspect of the head, possessing the eye, nose, and the mouth. It extends superiorly up till the upper border of your upper part of the forehead, or you can say that the first hairline, and from the inferior aspect at the inferior border of the mandible, and from the side to side at the both of the ears, basically. So this is the more or less limit of the face. And I want to add one thing here, that this forehead is going to be present as a common part in between the scalp and the face. Apart from that, this face is formed by the different structure. From the outermost structure, it is going to be formed by the skin. So skin is, it is thick, elastic, and highly vascular here, which is going to contain large number of sweat gland and the sebaceous gland. These sweat glands help in the regulation of the body temperature, and whereas the sebaceous glands are going to provide certain oily secretions. you know the face is highly lax in nature except the ala of the nose. And because why laxity is required to provide a certain number of facial expressions. Agar if face is not lax in nature, so whatever muscles are going to cause any contraction, so no expression will be generated if it is a tightened structure. Okay, then we are having the cleavage lines which are present in the case of the face. This for example, we are having the wrinkles which are present in the forehead and all. You can see that. So those are the wrinkles, or the moreover, these cleavage lines are not coinciding with the main wrinkles, so there could be a difference in that also. So just under the skin, there will be the superficial fascia. This superficial fascia is going to contain the muscle of the facial expression. Now, very distinct feature irrespective of the, which is differentiating the face with the other part of the body, is the absence of the, deep fascia in this region. So deep fascia is absent, but except it is present at some extents only in the region of the outer surface of the parotid gland is going to be covered by the deep fascia, and the some part of the your buccinator muscle, and it is going to be covered by the sorry, the masseter muscle is going to be covered by the deep fascia. But rest of the complete rest of the complete of the facial region is going to be devoid of the deep fascia. uh, Apart from that, in this image, I would just want to make you revise with the some of the basic landmarks of the face region. So this will be the frontal prominences, and this will be the your supraciliary arch. This will be your nasion somewhere here, and this will be the ala of the nose, nasal nares, philtrum part, upper lip, lower lip, and this will be your mental protuberance. This will be your zygomatic bone, and this will be zygomatic arch. Then this will be your tragus. This will be your tragus. This will be your antetragus. This will be your helix, this elevation of the ear, and this will be your antehelix. Then this will be the inferior border of the mandible, and this is the angle of the mandible, which is just as a more angulated structure over the inferior border. Just behind the ear, you can all of you can just palpate your mastoid process, which is just present behind the ear. It is a very most prominent structure behind the ear, pinna. So after that, we will move on to the muscles. So basically, first of all, I'm just going to tell you muscles as per the regions, okay, or the orifices, because we are having the major three types of the orifices, 3 to 4 type of the orifices which are present in the case of the face region. So that will be the orbital orifice, or the around the eye, around the nose, and around the mouth. So muscles are going to be grouped like that. So first of all, we are going to cover up with the around the eye. So around the eye, we are having the frontalis muscle, or the frontal belly of the occipitofrontalis muscle. We are having the orbicularis oculi muscle. We are having the nasalis muscle. This is the nasalis muscle number 7. This is the orbicularis oculi muscle. And then we are having the corrugator supercilii muscle. So this somewhere here will be the corrugator supercilii muscle, which is going to be present here. Now, in the case of the very important muscle, this is the orbicularis oculi muscle. It is having the three parts. One will be the orbital part, other will be the palpebral part, and then we are having the your the lacrimal part. So the orbital part, it is arising from the medial palpebral ligament, from the frontal process of your maxilla and adjoining part of the frontal bone. So somewhere here from the medial palpebral ligament, it is just going to have its origin. And then fibers form the complete elliptical, elliptical loop around the orbital margin. So they are just, looping around, and without any interruption, so before returning again to the origin point. So this is how complete a loop is going to be formed. It helps in closely tightly closing the eyelids, basically whenever there is any light or the dust particle is going to become. Then this is the palpebral part number 8. In this palpebral part of the orbicularis oculi muscle, it again arises from the medial palpebral ligament, and it just present sweeping towards the lateral side, over the upper and the lower eyelids, and it is going to be inserted into lateral palpebral ligament. So from here it is starting, and it is going to move up till the lateral palpebral ligament. So this is how it is going to be, present, and it is, present in the, eyelids, and lie along the margins of the eyelids. It just closes eyes gently, as in sleep or blinking. We are doing such kind of movement. Then there is a lacrimal part. It is lies more deeper in the lacrimal sac, so I'm not able to show you that part right now. But it is having the function. It just dilates the lacrimal sac by exerting certain force to the lacrimal fascia, and that help in the secretion of the lacrimal fluid. So all of these three parts are very much important. They are even clinically important as well. So in the case of the clinical issue, so sometime if there is the contraction of the entire orbicularis or oculi muscle, so the skin of the forehead, temple, and the cheek are going to be they are going to be they are going to be contracted, and they are going to be drawn towards the lateral angle of the eye. So somewhere like claw feet kind of appearance. If I'll just draw that for you, so it will be like this, somewhere like this. So it is not it's not seen. So somewhere like crow feet, we are having the three paws of the crow, so like that they are going to be appearing. So that was about the orbicularis oculi muscle. Now I'm moving on to the corrugator supercilii muscle. It is just it is just going to be originating from the medial end of the superciliary arch, and then it is going to pass laterally and upward to be inserted into the skin of the eyebrow. So basically, this is how it is going to be present. So it is just going to be dragging the eyebrow medially. Okay, whenever you are there is like expression of frowning or annoying. So in those cases, it's going to be doing its function. Then we are having the frontalis muscle. Uh, as we had also already discussed that also in our last lecture, but still it is going to be present, and it doesn't have any bony attachment in this anterior aspect, and if the blood is if there is any injury in the scalp in the second or third layer, so the blood is going to be seep around this eye region, because there is no bony a limitation to the that flow, the extra amount of the blood. So after that, we move on to the the muscles around the nasal cavity, or the sorry, the yeah, nasal cavity. So in this we are having again three muscles. One is your procerus muscle, other is your the major are the two muscles, the procerus muscle and the your nasalis muscle. So your procerus muscle, it is just arising from the nasal bones. This sixth number is your procerus muscle. This is your nasalis muscle. These procerus is going to produce some transverse wrinkle across the bridge of the or the root of the nose, as in frowning when we are doing certain movements. But whereas this nasalis is going to help the dilate your nares, it is going to act here, and it just does dilate the anterior nasal aperture in deep inspiration. So I urge you, all of you, to please do a deep inspiration, then you can feel the contraction of this nasalis muscle. Okay. After that, we move on to the muscles around the mouth. So muscles around the mouth are the the orbicularis oris muscle, which act as a sphincter, and there are the nine muscles which are converging around the mouth, all along the mouth, and they are going to be act as the dilators. So first of all, starting with the orbicularis oris muscle. So this is a complex muscle which is just surrounding whole of the oral orifice and forms the greater part of the lips. Okay, it has extrinsic and the intrinsic portion. The major extrinsic part is composed of interlacing fibers of the muscles which are surrounding the lip, and converging around the mouth for the insertion into the lip, which are levator anguli oris, levator anguli oris, then depressor anguli oris. We are having the this depressor anguli oris, levator anguli oris, depressor anguli oris. Then we are having the buccinator etc. muscle. So these are going to be acting as a different fibers. Then at the modulus they form a chiasma. So this is the modulus, and they are going to form a chiasma like structure. So upper and the lower fibers are, they are just mixing, the fibers are going to be mixed up here. Then this muscle is going to be supplied by the facial nerve, the buccal branch of the facial nerve. It is just help, because of its nature, it is capable of producing wide variety of movement in the lip, like closing, pouting, pursing, twisting. Number of the movement it is going to be happening. What about the, if there is a paralysis of one half of the orbicularis muscle, it will be prevent the proper closure of the lips. So there will be like salivation will be dropping of the saliva, which will be coming from the affected side all the time. Okay, dribbling of the saliva from the angle of the mouth. So that is going to happen if one side of the muscle is going to be paralyzed. What about the other nine muscles? So we are having the levator labii superioris alecknesi. So this muscle, this very lengthy muscle, the number 19th muscle, this is the levator labii superioris alecknesi. Then this is the levator labii superioris, levator labii superioris. Then we are having the zygomatic, the zygomatic minor, zygomatic major. Then we are having the buccinator muscle. Okay, then this is the levator anguli oris muscle. Okay, so then we are having the depressor anguli oris muscle. These are the certain muscles which are going to form at one single site, and they are going to produce different number of helpful in forming the different number of the expressions, and it will be help in enforcing this region. So apart from that, this is the region for the mentalis muscle, which is going to be present over here, and it is going to provide some like expression like puckering of the chin or the protrusion of the lower lip. So that kind of expressions are going to be coming from this part. So now again, to revise in this, you can see this is the fronto-occipitalis muscle or the occipitofrontalis muscle. This is the epicranial aponeurosis. This is the orbicularis oculi, orbicularis oris muscle. This is your nasalis muscle. This is the parotid gland from the outer aspect. This is your buccinator muscle. Okay, and this is your zygomatic major muscle. So this is all for regarding to the muscular part. Now we move on to the neurovascular bundles which are present in this region. So the nerve supply is going to be present in the two form, like the motor supply and the your sensory supply. Motor supply is done by the facial nerve, and the facial nerve, whenever it is coming, it is going to pierce the parotid gland, and then it is going to give the five branches here. So what are those branches? There will be a temporal branch, sorry, there will be a temporal branch of the facial nerve. Then there will be a zygomatic branch. Then there will be a buccal branch, which in turn is going to divide into the two parts. That will be the upper buccal branch and the lower buccal branch. And then we are having the cervical branch, which I am not able to show you right now. Okay, so this is how it is going to give certain branches, and then it is going to supply the different muscles of the face. Yeah, if there is any injury on the one side, so to this nerve, so there will be a condition that is known as the Bell's palsy. It is a lower motor neuron paralysis of the facial muscle due to compression of the facial nerve in the facial canal. So that we will discuss once we are going to move on to the facial nerve in detail later on. And apart from that, we are having the sensory supply, which is coming from the trigeminal nerve. So I'm not able to show you that, but we can discuss that from the supraorbital foramen. Your supraorbital nerve and vessels are coming from infraorbital canal. Your infraorbital nerve and vessels are coming, and from your mental foramen, your mental nerve is coming. Rest we will discussing that later on in more details once we are doing with the deeper dissection part. Apart from that, we are having certain more branches, that is your auriculotemporal nerve. This is again the one sensory branch coming from the your trigeminal nerve divisions, upper divisions, and then we are having the greater auricular nerve, which you can see here. These are the branches which are coming from your uh, trigeminal nerve. Last but not the least, we are moving on to the artery. So this is the facial artery. As you can see, it is a highly tortuous artery. Why tortuosity is required here? Because whenever you are doing any kind of the function at your mouth, you are doing chewing movement. Even I am talking right now, so I am moving my mouth in a different direction. So if this tortuosity is not there, so there is chances that this artery could be injured. That's why this tortuosity is required. Now this artery, which it is coming from, it is arising from the external carotid artery at the level of the greater corner of the hyoid bone. We'll do that in later on dissections part. And after our looped course around the just near to the in the submandibular region, it enters the face by surrounding the by winding around the lower border of the mandible at the anterior inferior angle of the masseter. Then it is just going to provide certain branching here, and it is going to supply the different regions. So it is having number of branches like inferior labial branch, superior labial branch, lateral nasal branch, muscular branches, and the I think your ophthalmic sorry, the last ophthalmic division of the facial artery. And then we move on to the the veins. So the basic vein which we can see here, so there are also certain more facial artery like transverse facial artery. It arises from the superficial temporal artery. This we'll do when we are going to do the deeper dissection part. And then we'll see this is the facial vein, this purplish structure. So this is the facial vein. It is going to be formed, it is the largest vein of the face, and it is formed by just the union of the supratrochlear and the supraorbital veins. After its formation, supratrochlear and the supraorbital veins, there will be number of the tributaries which are going to be end inside the this facial vein, and then it is going to be it is running downward straight in a straight fashion behind the facial artery, and then it is going to reaching the anterior inferior just this region, and then it is going to be joining the anterior division of the retromandibular vein. So below that it will going to be forming the common to form common facial vein, then it is going to drain into the internal jugular vein. So this is how it is going to be providing its surface. So this is your facial vein. Apart from that, we are having a region. This region is known as your dangerous region of the face, because the facial nerve and its communication are devoid of any valve here. in their liver. Since the facial now vein is just resting directly on the muscles of the facial expression, the movements or the contraction of these muscles will facilitate the spread of the, if there is any septic emboli, any infection which is present on the lower part of the nose or the upper lip, if there is any caruncle, if there is any blister. So there will be, with the retrograde kind of, movement or the motion. And as there are, number of connection in between the, this deep facial vein through the, to the pterygoid venous pressure and the emissary vein, the infection could reach up till the cavernous sinus. So cavernous sinus is one of the part of the venous system of the brain, and there are interconnections in between that cavernous sinus with the outer this region. So that's why this region become, this philtrum part and the surrounding part become very much important, and it could be a possible site of infection transmission to the higher centers. Apart from that, there are certain lymphatics which are present. We are having the pre-auricular lymph nodes, we are having the submandibular lymph node and the submental lymph nodes. So these, these are the, different number of the lymph nodes which are present, but I am not able to show that those lymph nodes in the, this image right now. So I hope you people understand this topics, and thank you for attending.